Recent outbreaks of diseases like measles are sparking a debate surrounding vaccination, in particular information or misinformation around vaccine safety. The Ontario government is now trying to fight that with a new research centre. It is based out of the University of Toronto. And Dr. Natasha Crowcroft is director of the Centre for Vaccine Preventable Diseases. She is also the Chief Science Officer for Public Health Ontario and joins us right now near Lindsay, Ontario. So Dr. Crowcroft, thank you for joining us today.
Thank you for having me on the show.
I want to begin with the timing of this. Why now? Why has this centre been launched now?
So we've been thinking about this for a very long time, and it's been a lot of work leading up to the launch of the centre. But the timing seems absolutely perfect with all the stories everyone's heard in the news about measles outbreaks all around the world. There's been a lot of concern for a long time about how people are thinking about vaccination. And indeed, the World Health Organization this year said that vaccine hesitancy is one of the top 10 threats to public health in 2019. Well, there couldn't be a better time for this.
Well, let me pick up on that because you mentioned vaccine hesitancy. How worrying of an issue is that, in particular in the Canadian context?
Well, it's interesting because there have been a few surveys on Canadian parents, and the majority of Canadian parents in surveys say they don't think the science behind vaccines is clear, which is astonishing to people like myself who've been working on the science of vaccines for many decades. And people like myself know the science around vaccines is incredibly clear. So we really do need to reach parents to get that message across. There's a problem in Canada and there's a problem around the world. I've just come back from a meeting in Southeast Asia where even there's beginning to be, in countries where they see diseases like measles all the time, even they're finding that parents are becoming less confident in vaccines.
Well, I'm going to pick up on that point in a second, but I do want to talk about the vaccination rate in this country. What is it like in Canada?
It's not doing that well. I don't want to over-exaggerate it, but most parents do the right thing and get their kids immunized. And most parents really do have faith in their own doctor and they take their advice. So, but our levels are not where they should be. So for the first dose of measles vaccine, we're reaching about 90% when we really should be getting to 95% or above. And with a disease like measles, those little gaps in coverage and immunization uptake make a huge difference to the risk of outbreaks.
The risk of outbreaks, because that goes to what herd immunity?
Exactly, yeah.
Yes.
Yeah.
So,
and we really need to be above 95% to be sure we're safe.
You know, I want to get your thoughts on the skepticism around vaccinations, though, because to my understanding, everyone that is hesitant about vaccines are getting the information from one study that has been debunked hundreds of times. In fact, the doctor behind that one study that tied vaccinations to autism wrongly, he apologized for that study. He's no longer even a doctor. But that kind of lives in the realm of social media and rumors. So how do you combat that? You know, as most academics will tell you, people don't read academic papers, but they certainly listen to rumors.
They certainly do, and the whole social media world we live in now, it amplifies those rumors really powerfully. And if you look on social media and you look on the internet, you get the impression that it's a very divided world, and there's a huge number, you know, that most people are anti-vaccine even. But that isn't the case. Most parents get their kids vaccinated. Most adults are not that anti-vaccination. It's this very, very small, very, very vocal group of people who are causing incredible damage. And so I think it's our responsibility to try and get out there and get correct messages out there. And that's one of the things we'd really like to do at the University of Toronto, is to get the amazing science that's going on at the University of Toronto and in other institutions out there, so people get to really understand how good it is, the quality of the work that goes into.
But how do you get it out there? How do you get, and forgive me for jumping in, we're running out of time, but how do you get that information out there that can combat the persistence of messages that have existed on social media for over a decade now?
So one way is participating in social media. The other way is through healthcare providers. So we're very keen on making sure that nobody who goes through the University of Toronto doesn't get the training they need in order to be able to give those messages to their own patients, to work with healthcare providers, doctors and nurses, to make sure they have the tools they need and the information they need, because they're the ambassadors for the program. And if your own doctor has the right information and tells you, and is confident in immunization, then that's really 90% of the battle.